Welcome to the Smart Aerialist podcast. I'm Ophelia, your host, an aerial coach, movement specialist, and lifelong performer. This podcast is for aerialists who want to train smarter, move better, and build strength and flexibility in a sustainable way. We'll dive into the science of aerial training, injury prevention, and long-term progress so you can keep growing without burnout. Whether you're just starting out or refining your craft, you're in the right place. Let's get into it. Welcome to the Smart Aerialist podcast, a new episode with me, your favorite coach with over 30 years of experience in the aerial arts. Today, we are going to discuss the injuries and particularly how we can keep on training with injuries. I know that injuries are always a difficult time and very often a setback that can feel very frustrating. However, you can always make the most of it. In this podcast, we're going to approach some tactics and techniques for you to not feel so frustrated by your injuries and see it as an opportunity for growth. Let's dive in. First and foremost, I want to remind you that I'm not a doctor. So I'm not a qualified professional to give complete advice. I want you to try and remember to ask for professional advice and do not rely on this podcast solely, as well as keep yourself in a reality check about training while you're injured. So never train injured unless you have been properly advised by a professional. Now, what we are going to discuss is how to explore possibilities of training sustainably while we are still recovering from the common aerial injuries. We can have a look at the common injuries, which are in aerial, let's be honest, shoulder injury tends to be the most common one, lower back pain, wrist issues, and you can also have knee injuries, ankle injuries. Obviously, it's not exclusive as to where you can get injured. However, it's more common to have some in the shoulders, in the wrist, and in the back. Of course, the most common shoulder injuries come from overhead movement, shoulder mounts, shoulder holds. It places enormous stress on your rotator cuff, your shoulder stabilizers. Looking at the wrist, we have generally tend to be overuse injuries. Repetitive gripping can cause tendinitis, joint pain, and also lower back pain with compression. Twisting movement can cause quite a bit of strain on the back and particularly the lower back with aerialists with pre-existing weaknesses or poor form as well. What I want to say as well is that I created another podcast a little while ago that covers the most common injuries, and I discussed this in a bit more detail. So please go have a look at these just to inform yourself on the most common injuries as well that you can get from overuse or from improper form in the aerial arts. It's very common to get injured. I myself have had many injuries. I've had shoulder injuries, I've had wrist injuries from a drop, for example, in aerial, in the hammock. I've had shoulder injuries from a repetitive strain from trying to get what we call this a skinner in Europe, but I think some people call this a Russian mount when you keep rolling backwards. And I've also dislocated my knee. This is not due to aerial, but because of the surgeries, I spent a substantial amount of time recovering, and also I've had the strain and overuse and poor form injuries as well. So I've been in this position previously, and I can understand where you come from when you're trying to keep training while you're being injured. Discussing how it's so important and imperative for you to be okay and accept that it's imperative sometimes to take a break. In aerial, we tend to want to push our limits. We tend to want to always go a little bit further and further. But in that case, that is not the best course of action. If you continue to do aerial, you keep pushing through weight-bearing movement, and that can seriously make it worse for yourself. And especially if you want to keep training with aerial, I seriously suggest that when it's time to take a break, you actually take the break. Because if you don't take the break, you're going to regret it along the line, and especially when you're going to start keep on trying same movement, or we are going to find a plateau because the injury is going to prevent you from moving forward and progressing as well. And even worse, re-injuring yourself. Pausing aerial training doesn't mean that you should pause all training altogether. It's quite important to still focus on your mobility, your flexibility, your conditioning exercises that do not strain where you are injured. We're not working on the place that is injured, but we still try and find ways to strengthen other areas while we recover. Obviously, with the lower back, it can feel a little bit different because there's a lot of movement that you might not be able to do. However, you can still work in other ways. If you have a shoulder injuries, for example, you obviously need to take a break from overhead movement, you need to take a break from pull-ups, you need to take a break from anything that can require your shoulder to move, but you can continue to work on your core strength and your flexibility in the lower body. And if you're dealing with lower back pain, then you might be working on mobility work and core stability exercise that protect your spine while improving the overall movement quality. This can happen as well with a lot of hypermobile people that need to actually strengthen also the area that has been injured. As someone who has gone through a lot of surgeries, through a lot of recovery, and through a lot of subsequent injuries, such as dislocating my knee because of my misalignment, my lower back injuries because of my spondylolisthesis, I can really vouch for the importance of using physiotherapy recommendations. I spent a lot of time with physios and they have provided me with invaluable advice throughout my journey while I was recovering. They also are really giving you a lot of motivation. And it's really important to listen to what they say, and it's even more important to do all this boring physio exercise. I know they sometimes feel really small and really boring, but remember, when you are doing the physio exercise, I want you to see them a little bit like when we do some Pilates or when we do some contortion training and we want to try and realign the body. They're not just exercises that you need to do in the wind without being mindful. You need to be intentional about your physio. And what's important is understanding that the physiotherapy is the first step to go back to aerial. The second step is going to be to strength train before you start putting strain again on the injured area, obviously after you are signed off. It's so imperative that you follow your physio exercise. It's imperative that you start setting goals as well, not just for recovery, but for other part of the body that you want to strengthen in the meantime, such as improving your grip, improving your flexibility, which obviously do not rely on the injured area. It's time also to take a moment to reassess your techniques. If you have yourself during an aerial movement that you've been practicing over and over, then it's time to ask yourself the question, what am I doing that has caused this injury to occur? It's quite important that you speak to your coach about this. This is quite a good moment as well for them to maybe have a look at your videos of you training. And this is why we value your filming yourself, not just for the gram, but filming also the nitty-gritty part of your training, because a coach can evaluate some of the movement pattern that might have not caused the injury, but how to correct that in the future when you want to try that move again. In the long run, obviously, this approach will lead to a lot more sustainable progress, and it will also allow you to return much stronger to your aerial practice and with better body awareness. So the next important thing, obviously, is the focus on mobility and flexibility. We do want to facilitate healing while maintaining your overall movement capacity. Mobility work also allows your body to just stay active without placing too much strain on the injured area. Mobility is also very good because it improves your blood flow and promote the tissue repair. It's also important for your joint to be kept moving through controlled and dynamic stretches, and also reducing the risk of muscle imbalances. This is your moment for you to work on parts of your body that need a bit more nurturing in terms of mobility. So in the science of recovery, blood flow and healing is taught that mobility will help get a bit more blood flow into the injured area. In the first part of being injured, you will generally completely stop and take a rest because you need the inflammation to work into the area. The inflammation is actually quite important part of healing. You need to get the blood flow. The inflammation is to bring as much blood as possible into the injured area. And what it does is when you bring blood flow, it increases the circulation, promotes the delivery of oxygen and nutrient essential for your tissues to repair. And it also helps removing all the waste product from your injury. Now, the ICE system, remember the rest ice compression elevation, was developed by Dr. Gabe Merkin, but it's important to understand that his stance on the ice has been retracted because icing injuries can actually delay recovery. It can be nice and feel nice, but what we were talking about, it inhibits the natural inflammatory process, which is essential for healing. Inflammation is the body's ways of sending the white blood cells and other healing agent. And then keep on moving your joint through gentle mobility is what brings the blood flow back as well to keep on that healing process. So it's important to understand that ice can delay your recovery. And if you're not sure, in the blog I do put the link to Dr. Gabe Merkin's official website. And also understanding that the mobility aspects on the injured area can really help, but this is why we do physiotherapy. The physio movements are basically gentle mobility to help the healing process as well. In terms of understanding the importance of mobility and flexibility, it's important to understand it from a preventing muscle imbalance standpoint, from corrective and realignment standpoint, but also helping your gradual return to your strength training. If you start doing mobility and your physio exercises, then you will be able to be signed off to finally come back to exercising. Coming back to exercising is not necessarily coming back to aerial training. You need to use this bridging moment to actually strengthen the area as well. This obviously needs to be cleared by your physio first, and your physiotherapist might also recommend you some strength exercise that are appropriate for recovery as well, and I do suggest that you also follow them. After this, obviously, if you get cleared to do a bit more regular exercise, then a strength training program that is quite easy to follow might be the next course of action for you. Again, it's important to work more on the form at the beginning rather than pushing through heavy weights. You're going to start bringing obviously low intensity exercises, then you're going to start a bit more weight bearing body weight exercising, a little bit with resistance band and maybe some dumbbells and maybe some other machine and equipment that is at your disposal. Why it's important to strengthen the muscle around the injury, obviously it's time when you start doing some smaller movement and you start using some isolation, not just completely going back into doing complex moves into your aerial practice. Yes, those are very complex. The going back to body weight training can really help. Body weight and weightlifting training in a strength program can really help you also reassess your technique and your isolation, how you actually move. So if you have a shoulder injury, you want to make sure that your overhead movements are performed well, and that also you are doing maybe more unilateral exercises to rebalance the left and the right, especially if your injury is on one particular side. This has happened, for example, for my left shoulder, and most of my program when I came back from my injury was to rebalance my left shoulder through unilateral exercises as well. So what's important as well here is to ask yourself if you are using the muscles properly. This is also the moment where once the physio teaches you the exercises, whether it's your mobility and physio exercises and the strength exercises, their job is to make sure that you engage the muscles properly, just like a personal trainer will do also when you exercise. You also need to make sure that your technique is correct. If you use and if you have any compensatory patterns, are you compensating somewhere else with the wrong muscles, potentially increasing the strain on the joint? I've explained numerous times on other podcasts and blogs that sometimes we tend to overuse the small muscles instead of using the strong muscles. So especially in aerial, we might not be using the lats and the serratus anterior adequately, and we put a lot of strain on the smaller rotator cuff muscles instead. It's important to strengthen those big compound muscle that helps with a much bigger strength aspect of your training in aerial, and therefore this is important for you to make sure that the physio can point that out to you. And are you following the correct progression? Are you skipping some key foundational movements? Now it's time to go back and look at your foundations. So unfortunately, you have to imagine your training and you as an athlete like a Jenga tower. If your foundation is shoddy, the whole tower will fall off. And it's important for you to reassess where you're at in the quality of your foundation training. And that also is another reality check. Unfortunately, you do have to look at that, because this is what's taken myself. My shoulder injury has taken me to reassess my foundation. Every injury I've had has taken me back to reassessing my foundation. And this is also where you start actually growing as an athlete. It's not just growing because you have a setback and you need to start over. You're not starting over, you're starting to reassess how to strengthen your foundation so you can come back better and also become a little bit more self-aware of what is lacking in your training. Obviously, this is helpful as well to keep going into your injury prevention tactics and strategy. You do not want to get injured again. So understanding your foundations, where is lacking, it's important here. It's important as well to keep with your physio exercise and your strength exercises for a while, even when you go back into aerial training. Making sure that you keep strengthening your rotator cuff, scapula, stabilizer, your core muscle, your wrist. If you're dealing with knee pain as well, for example, you will focus on strengthening your quadriceps, your hamstring, and your glute to protect the knee joint from excessive strain. So the shoulder is the same. You're going to keep doing this. And remember, your core is one of the most important part of your aerial training. If you keep having a weak core, everything else is going to take the slack. And this is going to create further injuries. It's important to get a really good and really strong injury prevention strategy. Obviously, your strength training will be progressive as well. You are going to do a gradual progression, because also when you take time off, your stamina will also go away. You need to make sure that you are not pushing too hard too quickly. You might start, like I said, with body weight, resistance band, then light weights. If you have shoulder injury, you work through your scapular movement. And if you have knee injuries, you focus on squats, glute bridge, and then you can start putting weight back on. With aerial, the same thing apply, which is where having a personal trainer can really help. So once you move on from the physio, a personal trainer is your best bet to make sure that you go back to training safely. That's what I tend to do as a coach myself. I tend to bridge a lot of people that have injuries from their physio path back onto aerial training to be more sustainable. Not just for that, obviously, if you have plateaus or if you want to learn new skills. But I think the real value behind a personal trainer that knows Aerialist is also ensuring that you do not get injured, helping you to have an injury prevention program as well. Now, we all have quite a high pain tolerant threshold, I reckon, as aerialists. I know sometimes we do feel the pain and we push through it. However, when is it not okay to keep going? It's important to understand the different kind of pain that we have as well. There is a science behind pain, and it's important to listen to the body in that way. The different type of pain, you have the one that's the acute pain, where it's saying to you a big no-no. So acute pain is the body's immediate response to injury or strain. It's quite sharp, sudden, and it serves as a protective mechanism. You need to understand when this is a big no-no and it's a sign and a big red flag that you need to stop. And that also can be not necessarily injuries, but also when you start pulling too hard on your nerves, and if you feel like little zaps, not necessarily pins and needles, but little zaps when you are particularly doing dynamic movement. I've had these before where the nerves kind of feel overstretched when you do dynamic movements such as drops and rolls, and you can feel the zaps along the arm. So this is a big no-no. You should stop, and this is reassessing as well, making sure you do nerve gliding and you work on physiotherapy exercises to make sure that doesn't happen again. This is important, especially when you start feeling tired or you're overtraining or you're burning out. This might quite appear sometime, and this is a big no-no. If you start having chronic pain, for example, where the pain persists over time, and you start feeling it lingering for weeks or for months, this might be that is an underlying condition like tendinitis, arthritis, a form of inflammation that's developing in your body. So now it's a sign of poor recovery, but it also could be your previous injuries that are starting to play up again. If you notice a recurring pain, now it's time to address it with a medical professional and physiotherapist before it gets worse, before you move into the acute pain of something a lot more serious, such as a tear or anything else. The discomfort is a little bit different. Discomfort versus injury pain. It's normal to experience discomfort. It's normal to feel soreness. It's normal to feel a bit tired and feel the muscles a bit in pain. But when we have a sign of something that's more serious, usually you would know. A lot of us are trying to ignore, but it's important to understand discomfort as a dull ache that can diminish after you warm up. If you feel better after warming up or after doing some mobility exercise or prehab exercises, that is fine. While injury pain will be kind of niggling while you are training. You're going to start feeling that something is not working quite well. So this is a time for you to start understanding that you should not keep going as long if it keeps hurting. Obviously that makes sense, but I know that a lot of us are always pretending otherwise. It's not pretending. Let's start listening to what our body is saying to us. Remember that the pain in injury prevention is a signal, and that's telling you that your body is nearing its limits. It's important to, again, always assessing your muscle imbalances, what you can do. If you don't have, like we say, an injury that's strong enough that you need access to a professional, then work on your muscle imbalance and work on strengthening the area to avoid the injury to get worse, as in getting to a proper overuse injury. If you feel sharp pain, for example, a shoulder mount, an inversion, or a roll, like I said, you need to stop pushing through, because if you keep going through, you can lead to further damage into your stabilizing muscles. Once you start tearing something, if you keep going and if you ignore the problem or if you don't rest adequately, you can start getting impingement, tendinitis, a tear, and this is going to take even longer to recover. It's important to understand when to stop, because otherwise you're going to make it worse for yourself. When should you stop? Like we say, sharp, stabbing, persistent pain that limits your range of motion, and obviously your swelling and a visible inflammation. Make sure that you view pain not as a challenge to overcome, but rather a guide to make a necessary adjustment. So reduce the intensity of your workout, modify your movement, take extra rest days to ensure your recovery is priority here. And obviously pushing through pain might feel productive sometimes in the short term, but in the long term, precision and control are essential. Ignoring pain can lead to long-term setbacks. You will be screwed if you keep pushing through that. It's important, again, to adjust your training approach as well. When you start hurting, assessing your movement, you can actually ask a coach to help you. Were you using proper form? Did you push past your current range of motion? Are you compensating? Again, always the same questions. You can always ask your coach to help you with that as well. And instead of powering through, modify the movement, lower the intensity, see if there are other ways for you to go through that movement, maybe in a more, not beginner way, but ask the coach if there are any modifications that are possible to that movement so you can build the strength and slowly step it up. Now, if you're in pain, it's important to start tracking it and keep a journal with your pain level, your progress, your physical response, because should you have a more serious injury, it's very useful first to discuss with the physiotherapist. But we all know that depending on which country you are, you might also need to advocate for yourself in terms of medical healthcare, especially if you do a lot of aerial training. You are considered an athlete, and when you're an athlete, your body is put through a bit more strain than a regular person. And for that, sometimes you need the doctor to understand that your craft is a little bit more demanding on your body and you need to advocate quite hardly. You need to make sure keeping a journal can really help, because everything will be written down, and even saying what kind of movement pattern you were doing that caused the injury, the warning sign, your recovery milestone, everything is important. Also, it does help when you're recovering. It also helps you see achieving some recovery milestones as well. It's also important to keep that as a note in terms of noticing the pain as well during your active recovery sessions. Just kind of noticing if the pain is getting better or worse after your strength-based drill, for example, as well. Over time, the data can reveal some trends, and it's important for your physio and for your doctor to understand that, to provide you with the best recovery plan. And this leads me on to really telling you to seek professional help. It's really important because a physio understands the mechanics of your body. They also, especially a sports physiotherapist, you need to make sure they understand the specificity of doing aerial is quite important, and you have to be picky with them. I'm very picky with my healthcare providers, but it is quite important to pick the right physio and make sure you advocate for yourself and get them to understand your exact needs. That's why I go back to using a journal to make sure that you go in details with your injury and all your patterns, so they understand how to advise you and to help you in the best way possible. As a coach myself, I've seen firsthand how important it is to bridge the gap between physio and returning to aerial classes. So this transition can be super challenging, and jumping back into dynamic, high-impact move too soon can really put strain on the body before it's ready. It's really important to get a coach or physio to design a strength program that is also in a controlled environment before performing, as I explained, complex and dynamic move back on the apparatus. When you work with a coach or physio in tandem, both of them can work together to really optimize your long-term growth in aerial arts. Finally, let's discuss the mental health aspects of recovering from an injury. And as someone who has had a fair share of recovery time, let me tell you, this is very important as well. It's mentally exhausting to be injured. It's very frustrating. You can get very impatient, and you can also be very fearful about losing progress. There is a real thing about feeling inadequate and having some deep insecurity starting to come back from the depths of your roots. It's important to really focus on what kind of dissonance can appear, the feelings of dissonance that can appear in your mind, and how it affects your self-confidence. I'm telling you this as someone who was told as a doctor, by a doctor, you should not be doing any more aerial. And because I got increasingly frustrated about everything, I literally stopped training aerial for nearly a decade. I didn't stop training altogether. I didn't stop doing other things, but I felt so frustrated and so upset that I became an all or nothing kind of person. And instead of trying to go back, I just gave it all up. So this is why I am telling you, try to find some form of acceptance. And as I explained, injuries are meant to be helping you not just grow as an athlete, but also grow as a human being. It will help you also go back to your foundations in aerial, but it will also make you more resilient in being appreciative of what your body can do, and also appreciative of trying to prevent coming back into this situation. And remember that aerial is not your entire identity. This is what was the problem with me. I made aerial, I made circus my entire identity, and it was like a house of cards. It's actually really weird talking about it right now, because I'm realizing that every time I'm realizing how much time I've wasted by just feeling like I wasn't good enough to do anything at all, and therefore just didn't anything at all. So my whole identity felt like was crumbling down, and I had to build a new one. But that's not the case. You're still your own person, even if you're injured, even if you see other people progress while you are recovering. It's so important to work on your mental health as well. So obviously journaling can help with processing your emotions. Sometimes really long-term injuries, you might, if you can afford it, get some counseling, get a psychotherapist. If you have a therapist, obviously already, that's brilliant, because they can help you break through some really tough emotional moments that you might have while you're injured. It is important to try and let yourself navigate your feelings and your emotions as well. I remember, again, trying to avoid doing that, or feeling very alone in my emotions and feeling that I couldn't really be understood by anybody else, and isolating myself from it all. I think that's why also I cut it off completely, because it just didn't feel like it was fitting in my life anymore in comparison to how much I was involved in it. And I think it's really important to understand that it's not just your entire life. It's an important part of it, and it's okay to process the emotions that go with being injured and taking a long time to recover sometimes. So in the blog, I will put some journaling questions that can help you to work on those psychological aspects of being injured. If you have obviously any question, or if you have anything to share, I'll be happy to hear your stories as well. I will do another episode where I'll talk a bit more about my story on the psychology of everything that I've been through. But just so it's very important to understand that you're not alone, and that it is a very difficult time to feel injured when you are used to training a lot, especially if you're someone who also performs, for example, or do other things that are very much related to circus in your life, and you're not alone. Everybody feels the same, and this is important as well, to leverage your community and making sure that you have a community that helps you also during your recovery. And lastly, obviously, reframing your mindset. Like I was saying, it's important to understand that you are becoming more resilient, and accepting and finding acceptance is not giving up. It's just acknowledging where you are in your recovery, understanding that setbacks are just normal part of life. Unfortunately, no one was teaching me that when I was younger, and working through insecurities such as fear of losing the skills, your strength, it will help you just become more resilient. If I came back from it, even after such a long time, and also for me, finding acceptance now that I'm getting a bit older and there's a few things that I'm okay with not wanting to try or not wanting to do anymore, my mindset has completely changed. I still struggle with insecurities, but when you go through injuries, you understand how to appreciate yourself a bit more and just be okay for the journey that you're having a little bit more. Again, you can always use some journaling prompt to help you with that, which will be in the blog that will be attached to this podcast. So I think that's it, that we covered pretty much everything in this episode. I hope that you found it helpful, especially if you are currently injured, but not just if you're currently injured, but if you're at the beginning of your journey, if you have been already, if you currently want to come back very quickly. I hope that this episode made you understand how important it is for you to be patient, but also find the best strategy and optimize the way you come back to your aerial training so you can come back better and stronger. But regardless, you always come back as a different person. We're always so attached to who we were before our injuries, but it's actually a beautiful thing when we come out and through them. We come back and we are even stronger, and we are even more resilient, and we have grown because we appreciate our body and we take care of our body a lot better after we've been injured. And I hope that you've learned that through this episode. Don't forget that you have everything on my YouTube channel, and that if you are looking for programs that help you bridge that gap, so some rehab and also some mobility, but also some strength training program, maintenance or rehabbing, the Aerial Performance Lab is my coaching platform where you will find all the tools that you need to help you become a better aerialist in terms of training sustainably. And I also welcome all the comments, all the shares that you do to your friends. Like I said, I'm just here in front of my computer, and it's always nice to see when people actually comment or let me know that they've watched or listened to this podcast or read the blog. And I really appreciate every single one of you. You help me expand and build this community, and I will see you in the next episode. Bye. I also want to remind you that there is a treasure trove of free content that you can access and I create for you. First of all, with every episode, you will see there are show notes where you can access the blog that relate to this episode. The blog dives a little bit deeper into details and also provide added references for you, some extra reading and some science papers that have inspired those episodes and those blogs. Second of all, you can also check out my YouTube channel where you will find a lot of workouts and flexibility, conditioning and strength exercises that are suited for aerialists in particular, but just not aerialists as well. And finally, don't forget to check out my app and the Aerialist Performance Lab.